Welcome to the Changemakers podcast, brought to you by Graf-Martin Integrated Marketing Solutions for Good. This season, we're focusing on what nonprofit leadership looks like in this next normal. I'm your host, Ellen Graf-Martin, and each episode, you'll get to join me in conversation with some of my friends and peers in the Canadian nonprofit space who are changemakers and groundbreakers across Canada and beyond. Let's jump in. Welcome, everyone, to this very special episode of the Changemaker podcast. I am so excited that you get to meet my friend, Janet. Janet has a lot of wisdom and a lot of experience in the world, specifically the world of people living with disability. And so we're going to talk about a topic today that doesn't get talked about enough, especially in leadership, ministry in the church. And I've had the privilege not just of being Janet's friend, but working a bit alongside her through this COVID season. And so we're going to dive deep today, so be prepared. But welcome, Janet.
Well, thanks so much, Ellen. It's great to be here.
So, Janet, can you start by just telling us who you are, what you do, and why you love it?
Oh, sure. Gosh, I might take a while, but I'll try to be succinct. As you mentioned, my name is Janet Noel-Annable, and I am the Chief Executive Officer for Chirstian Horizons. What do I do? Or what does Chirstian Horizons do? We provide supports and services to people with primarily developmental disabilities here in Canada, and broadly to people with disabilities in some developing communities across the world. I've been a part of Chirstian Horizons for 31 years, started as a casual employee while I was in university, and never dreamt that God's intention was for me to first spend my life serving at Chirstian Horizons as well as leading as the Chief Executive Officer in these days. So it's an incredible privilege, and the journey has been so fantastic and awesome. I've learned so much, mostly certainly from colleagues and others, but mostly from the people who use our services.
So why do you love what you do? You got to love it if you're there for 31 years.
Sure. People with disabilities have been on a journey for decades and decades, both here in Canada, around the world. And that journey is not over. Years ago, we used to see people with disabilities as someone different and people that should be othered or set aside from typical society. And I'm so grateful that we've learned that is so not the case, and that our communities are better when everybody has an opportunity to belong and contribute. But I guess the work that Chirstian Horizons does is to be the lever or the catalyst, providing the right services and supports so that people actually have the opportunity to belong. When people face challenges around housing or services to help them get a job or to live just day-to-day life that so many of us take for granted, in the absence of those services, people are left out. And so Chirstian Horizons' job is to fill in that gap so that people both are contributors and participants in their community, but also that the community benefits from their presence and contribution. Mm-hmm. That's what I get excited about. And I guess when I started my career 31 years ago, things were pretty different. And I think we've made some great progress, but there's so much work still to do.
Mm-hmm. So what we heard is kind of the idea behind Chirstian Horizons. Right. What do you actually do at Chirstian Horizons?
Sure.
And here's another big question is I think some people assume Chirstian Horizons is just this small organization, and maybe break that bubble for us.
Yeah, and I guess we're kind of small, but we're kind of big because our focus is communities. Our focus is each individual person, the way that they want to live their life in their community with their friends and their family. And then organizationally, we actually have grown quite large. We are the largest service provider in Canada, and we provide direct services across Ontario and across Saskatchewan. We also fund projects around disability broadly in 6 developing countries around the world. So yeah, we're a pretty big organization. In Canada, we have about 3,500 employees that work alongside people in their communities every day. And what do we do? Well, we have residential support programs, and that's our focus in these days through COVID. And I guess we'll get to the reality of COVID for sure. But we provide residential support. So maybe you might think of a group home or a small community residence of 2 or 3 people. That basically our job is to help the people that live there live their lives like you and I live. So whether it's to help them on a day-to-day basis around meal preparation and grocery shopping and taking care of their home and being a good neighbor. Maybe it's helping them access a faith community of their choice, and maybe facilitating the development of relationships and friendships that, is really the stuff that good lives are made of. Maybe it's helping them get a job. We provide supports to families of children as well, providing them respite and opportunities just to take a break in the important care that they do every day. We have day supports and employment supports. We help people get jobs. We have this really cool project in partnership with Humber College in Toronto to help young adults actually access post-secondary education in a couple of specific fields. And I think the employment rate of people coming out of that program is over 90%. So over 90% of the participants actually go out and find full-time or part-time work long-term. So just fantastic program. I mean, you and I know that when each of us, or when our kids or our loved ones, people that we care about, when you see them launch, people with disabilities, our job is to maybe help them launch.
That's so good. Now, and this is very different than in the past. We were talking about 31 years ago. We talked about, and I grew up, a little bit about my story, and I grew up in a family that was very involved with people living with intellectual or developmental disability, and institutionalization was the way it was done years ago.
Sure.
So what has changed? This sounds very different. What you're talking about is very different than what I grew up with.
Yeah, sure. I'm really glad you went back there, because when Chirstian Horizons was created in 1965, a young man named Stephen Reese was born. And his parents looked around at the options for him. He was born with a developmental disability. Jim and Adrian were, people of strong Christian faith. Jim was actually an evangelical pastor, and he really felt called by God in those moments to find out what God's plan for Stephen's birth was. And, initially they were worried and afraid, and both Adrian, Stephen's mom, and Jim, Stephen's dad, felt called by God in the moment to understand Stephen not as a burden or a challenge, but a true blessing in their lives, in the lives of their family, and turns out the lives of the world, because they went on 2 years later to establish Chirstian Horizons. In those days, really all there was for people with developmental disabilities were large warehousing institutions that, we can look back and see all the problems with that, but it was all that people knew at the time, right? It was certainly I've heard from families who told me that when their child was born, doctors told them that they must send their children to these institutions, that actually it was selfish for them to keep them at home for their own sake, but that they would have the best life in these institutions. I'm so glad that has changed, my goodness, because we know there's institutions, kept people away from the journey of life, from relationships, from love and commitment. And I'm just so grateful that we have learned in the recent decades that those are not where we want to see people with developmental disabilities live. So Jim and Adrian looked around and they saw the movement of community living starting. So in different places, family groups were getting together and putting together services and supports for people to be able to stay in their communities, to stay connected with their families, to go to school, that sort of thing. And they saw community not as a geographical, Jim and Adrian saw community not as a geographical sort of requirement. They saw a community of faith as also an option. And so they established Chirstian Horizons. We started with a summer camp. We established our first group home here in Waterloo in, I think it was 1975, 1976. And then we went on to create, in partnership with governments, the Ontario government, the Saskatchewan government, all sorts of spaces for people to live and work and be a part of their community. So that's where we came from. I would say in these days, we still have much work to do, both from a shaping society's perspectives about people with disabilities. You and I know what it means to see a community where everybody belongs. Lots of people still don't see that, for sure. And we saw evidence of that through COVID-19. But we also, there's a lot of people that don't have access to these supports. I think your listeners or your viewers would be shocked to know that here in Ontario today, there's upwards of 15,000 people on waiting lists who are living at home with aging parents in their 80s and 90s that have the most minimal of supports in their lives. And they're just waiting for the big crises to happen when something happens to their parents. You can imagine having an adult child who requires help, maybe getting a bath or managing the activities of day to day, and you're in your 80s and 90s. There's work for us to do, and we must do better to meet those needs for sure.
And I would say, and I know I've shared this with you, but one of the things that shocked me during this season, I remember in April sitting outside our home, and a woman who I would expect is in her 80s, started walking in our neighborhood with her son, who is developmentally disabled. And we had never seen them before. And I've lived in that home for 11 years. And I know she was supporting her son. And I just thought, how have we never seen them before? So they're hidden in our own communities, and this shocks me. So the concept for me is, so what do we do? And I know at the beginning of COVID, you and I talked, and when I was hearing about the people that Chirstian Horizons supports, I remember telling you that I was talking to a friend, and he said, "Oh, I totally forgot about the people living in a Chirstian Horizons home in COVID. My in-laws used to volunteer there. Oh, I haven't heard anything about them. So why?" So, okay, I know you guys were working hard.
Yeah, you saw my gray hair developing.
Why didn't we hear about this? So how do we still not know is one of the questions. How do we not know that 15,000 people are on a wait list in our province right now?
Mm-hmm. Mm-hmm. It's a great question, Ellen. I think that we have different levels of knowledge, right? If you are a family that has a child with a developmental disability or autism, you're probably more aware of the services that are available and the lack of services that are available, and the struggle that you have day to day in these times. I think if you are a neighbor and there's a lady down the street with an adult son who lives with her, the reality is that people's perspectives are just, we haven't gotten to the place where we see people with developmental disabilities as a part of our community, as a necessary part, not just a person who requires care or services, that sort of thing, but actually their presence and the gifts of just their humanness. We believe at Chirstian Horizons that all people are created in God's image, and all people are valuable in God's eyes. In my eyes, and hopefully in everybody's eyes in some days. But, that concept of value and contribution, society still hasn't gotten there. And, some of the work and some of the outcomes of even this podcast, I hope, is to maybe nudge a question. Like, if you have a church, if you're a pastor of a church, and you don't have the presence of people with developmental disabilities, not as recipients of charity or benevolence, but as contributors, as leaders, as congregationalists, you're missing out. You're missing out both on what you should be, but also what you could be, right? So many churches, when I look across even our community here in Waterloo, there's a real absence of people with developmental disabilities. And if there is a presence, they may sit in the back pew, or they may be okay to be there unless, they start to vocalize or communicate in a way that's uncomfortable for people. And then maybe it's time for them to go. And that's not okay. God's plan for our communities wasn't that everything was quiet and perfect and smooth. It's messy and it's busy. And we believe that, the church community could go a long way. Separate from the church community, I think of employers. I'm looking out my window over at the grocery store across the street. There's nothing that gets me more excited when I walk into a store and see the presence of an employee who has an obvious developmental disability. I mean, certainly I recognize that there's lots of people with disabilities that are working and you wouldn't know. But when I get so excited when I see an employer who has gone the extra mile to create an employment opportunity, and what employers are telling us, and Mark Wafer, who used to own a chain of Tim Hortons, he said the return on investment of hiring a person with a disability was phenomenal. He said not only are typically the people who he hires great, phenomenal workers, but they also contribute to a culture in the workplace that allows for people to care for each other, to take care of each other, to help each other, which everybody benefits from. And then, with regards to just from a business interest, the percentage of people with a disability in our communities is high. And when you expand that to their families and their circles, a person who's connected to the disability community walking into a business, recognizing that that employer hired a person with a developmental disability, is really good for business. So that's kind of some of the things that we get excited about. There's a real absence of it right now, and hopefully through talking about it, providing the right support so people can have access to the right things in their community, and then advocating for growth and expansion of supports for people, so that those 15,000 people can actually benefit from these kinds of not just services, changed attitudes, changed opportunities. I truly believe, and Chirstian Horizons truly believes, that our communities are better, our communities care for each other more, and our relationships are stronger when everybody gets to play, when everybody gets to participate. And that includes a person with a developmental disability.
Mm-hmm. And I have heard people say, but I'm afraid I don't know what to do, or it's awkward. And I think we have to become, maybe 2020, a gift of 2020 is to help us become more comfortable with our humanity and being a bit awkward and not knowing all the answers. Because it's interesting when you say, I don't know that I've visited a ministry or a client that actually has a person with that is an obvious intellectual or developmental disability working there. And so, it kind of starts at I don't know if people have even thought of that. So inclusion means everyone is included. Is that correct?
Absolutely. And inclusion is an interesting word. We don't typically use inclusion as much as maybe broader society does, because I was working with this professor out of the University of Edinburgh in Scotland. His name is Dr. John Swinton, a brilliant man, and he spent his life studying inclusion and the integration of people with disabilities, people with mental illnesses into broader society. And he says, inclusion is great. Inclusion means that there's a space for you. It typically means there's a government legislation or law that requires that you be included. But belonging is what we want to focus on. Belonging means when you're not there, you're missed. It means when you're not there, someone goes looking for you and wants to bring you back. And all of us want to belong. And particularly people who have been on a journey of not belonging for their entire life and generations before them, belonging to a group, belonging to a workplace, belonging to a church community or another faith community, belonging to a neighborhood. That's the goal for sure.
So good. So good. And I have to say now, one of the things that people have said to me, and I'm sorry, I didn't prep you for this, but when I was supporting a friend last year who was working on an accessible park project, and not just the park, but the bathroom. So sounds funny, but an accessible bathroom
absolutely
means that you can belong in your own community, because you don't have to worry about being able to use the porta potty with your child who requires toileting help or whatever that is. And when we were doing the fundraiser, what I kept hearing was, but isn't this a government job? Is this our job? And so do you find the same thing in your work with Chirstian Horizons?
I'm so glad you asked that question, Ellen. I think we have absolutely seen it as a government job. And I am so grateful for the many millions of dollars that government gives us every year to provide core services. But I know my life would not be very full if I looked to all the things in my life to be provided by government, if I was sort of embraced by government services. For sure, there are services that I want my taxpayer dollars to fund. And for too long, we've seen a person with a disability as the responsibility of government. All of us as participants, as players in a community, are the responsibility of that community. And when a community cares for each other, I often use this sort of example of a pie. And I think for too long, we've seen that pie, all of the pieces be filled by government institutions. They were exactly that. Even services in our sector we've seen all parts of a person with a disability's life as being provided by government. And maybe that was easy, and maybe it was safe, and maybe even there's no question that there is a need for government-funded services. But how amazing when a community comes together and says to a little girl who needs help while she goes to the bathroom, that you belong in this playground, and we're going to do whatever it takes. We're going to raise money. We're going to change attitudes. We're going to, create this accessible bathroom so that you can come and play and you can build friendships and that you belong just like every other kid. Chirstian Horizons, most of our work is here in Canada for sure, but we get pretty excited about the work we do overseas. And I'll never forget visiting Asella, Ethiopia. I'm so sad that I can't go there these days of COVID, but Asella, Ethiopia holds a real special place for me, for sure. And I like to run. At the time, I was actually doing a lot of races. And so I was doing a little bit of running around Asella. And so I got invited to their track. They have a running track, and it's a pretty impoverished community. And when you drive to this place, you're passing all of the huts and the open sewers and all those sorts of things that we typically would see in a poor community. But when we came in through the gates of the park, it was a beautiful track, and government has really invested in track and field facilities around Ethiopia because there's such athletes from Ethiopia are phenomenal, including athletes with a disability. And so I was invited to go and work out, do a few laps with the local Disabled Athletes Association. Sorry, I'll get to my point. I'm sorry.
You're good.
So we do this run, and I got to be honest. So it's athletes with disabilities and without disabilities, and me, who stuck out like a sore thumb. And every time I'd round the corner, the coach would say, "Are you okay?" Like, I'm fine. But I don't think I was comparing to the incredible athletes in Asella. But anyway, after that meeting, we got invited to a meeting. After the run, we got invited to a meeting. And as we sat around the table, there was Chirstian Horizons global employees there who I was there visiting. And so that's the system through which, or the organization through which we provide funding in these communities. And so the employees of Chirstian Horizons Global were there. The head of the Athletes with Disabilities Association was there, and the regional government. And so what was happening was we were going to fund a project, but they wanted to leverage the relationship with the regional government for a lasting impact. And so what happened was the Athletes Association asked me, could you fund, we need some equipment, we need some uniforms, we're going to be competing at a national level. Would you provide, I think it was equivalent of about $5,000 for this project. And we have that money in our budget, and we had come to make some of these decisions, and it's certainly something that we typically would fund. And so we said, yeah, we would be happy to fund that. And then they turned to the regional government and they said, we're going to need some space to store this stuff at the track, right? This is a beautiful track. It hosts events of people from all over Ethiopia, the businesses that come, and sort of it's a big deal in that community. And so the regional government then said, sure, we'd love to house that, give you some space to keep your stuff and have meetings and that sort of thing. And they said, well, that's great. And so again, we just funded this project. So there's a leverage happening, or catalyst. So then the people from CH Global and the partners from the association, they say, but, it'd be really good if that space is accessible and sort of prominent and sort of in the front, not way out in the back. And they said, sure, we can do that. And, a bit of conversation and negotiation. And then finally it was, and it'd be great if we had some signs. It'd be great if those signs said, the athletes in Asella include people with disabilities. And so, the regional government said, yeah, for sure, we can do that. That's a great idea. And so we signed it all and got the deal done. But what happened was we left there, and I was thinking, the uniforms will last a couple of years. The equipment, hopefully a few more years. But the prominence and the place in the community, the changing of attitudes, that will last a lifetime. And that will seep out into employment opportunities. It will seep out into families of children that are born being with a disability, not seeing them as a burden, but as a blessing, just like Jim and Adrienne Reese did 55 years ago. The potential of that investment was longstanding and deep. So that's kind of a great example for me of what Chirstian Horizons wants to do, both overseas as well as here in Canada, is how do we leverage the resources that government gives us to grow. I think about what God said to Moses, and, what do you have in your hand? We can see a staff as a staff, or we can see a staff as a miracle that parted the Red Sea. And I think for Chirstian Horizons, our relationship with government is incredibly important. Our funders, our donors that contribute to us, we want to take those resources and we want to leverage them to be a catalyst in the community that changes attitudes, that sees real shift to a playground that includes every kid in that neighborhood. Does that make sense?
Oh yeah. When you speak, I like my social justice heart says yes. And I think what we don't realize, this is a justice issue.
It is a justice.
in our backyard that we don't talk about because maybe it's not as obvious, but this is a real justice issue that the church plays a role in, and ministries play a role in, people of faith play a role in. So how do we start talking about it? Like, if you were to say to a church leader, how do you just even start thinking about a strategy to create or facilitate a community of belonging for all people? How do you do that?
Just to dial back for a second, I think it is absolutely a justice issue. And I would say it's such also an opportunity. If I was a church leader, I wouldn't see this as something we must do or must get done. I would see it as an incredible opportunity to grow my church family in a way that not only will deal with people being left out, and that's wrong, but it will actually create a better church. It will, one of my board members, who's been a board member and a member of Chirstian Horizons since we started, I mean, he's an incredible man, but he said he saw Chirstian Horizons as an opportunity to push the church outside of its walls. And I love that. I love being an extension of the church and promoting what we truly believe, that God created each one of us in his image, and each one of us are loved and valued by God. But I also think it's an opportunity inside the church. And when you start to reshape, I participated in a church service in Ottawa. They're doing some amazing stuff up there. And it's actually where I started to work for Chirstian Horizons as a casual employee. So imagine my first day at Chirstian Horizons 31 years ago, and I walked in and I met this fella named Joe. And Joe, he's just such a man of God. Oh my goodness. His faith just shone out of him in everything that he did. His encouragement, his commitment to weekly Bible study, his daily prayer and devotion, and his participation at his church. But in those days, when Joe went to church, and sometimes I had the privilege to go with him, he sat in the back and was kind of accommodated, and it was fine. I mean, in those days, we didn't know much better. So I'm by no means condemning the church. But, I think it was about a year and a half or 2 years ago, I was up in Ottawa, and I watched Joe stand on the altar with the pastor and shared the sermon. Then he went on to actually be one of the Eucharistic ministers and gave communion to the church. And I thought, wow, this is it. This is when I think of kingdom coming and the what our God intended for our communities to be. That was a great example for me. So if I could encourage a church, I don't know what the right step is. It depends on your church, but I guarantee you there's people in that church who have a connection to people with disability. So maybe the first question is asking them. Actually, I'd be remiss if I didn't tell another quick story. Is that okay?
I love your stories. You're making me cry though. It's good.
And maybe it's a little bit harsh, maybe, but it's a really great learning opportunity. There's a pastor in Ottawa that I've traveled. He's come and actually been a part of some of our work in South Sudan, and his name is Jeff Scott. Terrific guy, long-term. We've known him for years. He and his wife Ruth. And Jeff said to me one day, he said, Janet, there was this family that I had the privilege of counseling one day they came to see their pastor, and they were considering abortion because they had just found out that their child was going to be born with profound disabilities. And they were being, it was being advised that they consider abortion. And he said, they came to see me because they were really troubled, and they didn't want to have an abortion, but they didn't know what else was out there. And so he, shared his perspective that child was a gift from God, and that child, God had a plan for that kid, just like every other kid that was being born in these days, in all days. And they went on and they didn't have the abortion, and the child was born with profound disabilities. And, initially when he was an infant, they would come to the church, and as he became a toddler, they would come to the church, and he would go to the childcare. And maybe when around 3 or 4, he was invited, or he would be a part of children's church. And he stopped seeing this family. Like, they'd see him once in a while, or he'd see the mom or he'd see the dad. And, he was a busy pastor. Life took all over, and, in his life and that sort of thing. But he ran into this family a couple of years later. And he said, we haven't seen you at church lately. We haven't, had the pleasure to see, so-and-so as a child. And he said, how come? Have you changed church? Did you move? Where are you guys? And he said, well, and so the mother and the father kind of looked at each other and gave each other a hard look, like, the look that you give when you're thinking, do I tell you or do I soften this? And they decided to tell him. They said, to be honest, church is too hard. We're tired of when our child acts up, people looking at us with disdain. We're tired of being called to children's church and asked to, I'm getting emotional, asked to take my child home because they're just causing a disruption. Mm-hmm. We're tired of being the people that are left out. And so church got too hard. So we just stopped coming. Mm-hmm. And Jeff, in that moment, just felt like he got hit with a bowling ball right in the stomach. Mm-hmm. And he said, we have absolutely blown it. If there's one thing that church should have been, would be to walk with that family as they raise this child, the child that he advised them not to abort. Mm-hmm. He knew that God had a plan for, but the church let them down. So, if I was saying I'd tell that story to a pastor and say, figure it out. Don't see a person with a disability as a recipient of charity or benevolence or those poor unfortunates. See them as a contributing member, as an equal, as a citizen, as a potential Eucharistic minister or a children's church leader or whatever the gift the person brings, because the churches are missing out.
Janet, I'm so glad you took the time to share that story, because I feel it too, and I've experienced it personally in church, and so I know that it happens, and I know this is an important conversation that we need to have. Are you a nonprofit leader passionate about your organization's mission but unsure how to communicate it effectively? Do you wish your communications budget went further, that your development and communications teams worked better together, or that you had a stronger plan to find new supporters? At Graf-Martin Integrated Marketing Solutions for Good, we get it. With you in mind, we've custom-built solutions for nonprofit organizations to make your message have more impact, reach further, and connect with the right people for years to come. Schedule your free consultation by emailing solutions@grafmartin.com. Again, that's solutions@grafmartin.com. So it almost seems silly to ask, okay, so what happened differently this year and how has your work changed? But it actually is a play off of this, because when people with disabilities, if they were included in church, disappeared from their church this year, what happened? So how have the people you support been affected in this season?
Yeah. I'm glad we did flip to this, because this has been, 6 months has been the most, something none of us could have anticipated or expected. Maybe we should have anticipated, if we listened to the scientists and maybe we're a bit more real about what was going on in the world, we would have been a bit more ready. But it's what we all got caught. And I remember last March when we had to shift 180 degrees. We had to go from at Chirstian Horizons and many service providers like us, our job is to get people out, go make friends, go socialize, go volunteer, get a job, be out. The sign of our success is actually how many connections we help people make. And all of a sudden we had to say, no, you have to stay in, you can't go out. And for people with a developmental disability who may have not been a part of some of those conversations early on, it was a major shift. And we had to become very focused on containment of this virus, of infection prevention and control, of health kind of thinking in our spaces that we had never really considered before. So one of the things I'm so grateful for is that Chirstian Horizons got through this remarkably well. There was 1,500 people, that use our residential services. So we provide support to 2,000 or 3,000 people, more broadly and specifically around community programs and respite and that sort of thing. But specifically 1,500 people depend on us for their residential supports every day. And we had to go into lockdown. Our employees had to shift everything that they did in providing supports, in ensuring prevention of infection, of monitoring people, initially no one coming in the home, but now managing visitors and creating opportunities for families to get together. It has been an enormous amount of work and effort for sure. And, the impact on people has been profound. But, Ellen, I got to tell you, while I wish this was over today. I wish we were done. I can't, I have to be really transparent. These 6 months, we have seen the most incredible things from people, the resilience and strength and creativity. The 1,500 people that depend on us for services residentially, that could have been a public health disaster, right? If what we saw in long-term care of dozens and dozens of people contracting the disease in each space and dying, we could have been affected by that. In fact, many of our employees work for us and work in long-term care or in other congregate settings. And the early transfers was often between employees working from place to place. That was a huge shift for us. Employees had to give up other jobs and work 12-hour shifts with us. It was an enormous shift for us. I like to say we actually turned 180 degrees in those days. And you might wonder, how did we get through it? Like, how did we do all this? And I would say 3 reasons. One, I think leadership was really strong. I think leadership at all levels. I think government, Prime Minister Trudeau, Premier Scott Moe, and Premier Doug Ford here in Ontario, I think they did fantastic. I think they got out and they got money out to us to be able to mobilize the things that we needed to mobilize. Within Chirstian Horizons, across the board, leadership was outstanding. And immediate communication to all of our stakeholders, including the people who use our services, immediate action, even before government directives were in place, because it did take a number of weeks. And people, they took action. And I think leadership was one of the absolute keys. The second would have been partnership. Certainly, we had the ability to influence up to government policy and directives in the public service. And we had the opportunity to work with organizations and just people to make it happen. I mean, whether it was another social services organization, whether it was public health, or whether it was a quilting group here in Waterloo who sewed masks for us. I mean, it was absolutely incredible, the effort that came together. I mean, we had people showing up at our program sites with meals and cookies and signs put on our lawn that said, "Heroes work here," to inspire our staff. Family members, we created a benevolence fund right away because, like I mentioned, employees had to stop work at other places and funds got tight. It was really intense, and it continues to be for our staff. So we created a benevolence fund that was for both our employees as well as the people who use our services who lost revenue in their jobs that they couldn't go to. And that was amazing. We saw people contribute to that. It was just incredible commitment of partners across the board. And then the third, and I think the most important for Chirstian Horizons, was people. Our employees went above and beyond. Our employees stepped up. We truly believed last March that we would really struggle for hours and supports in our programs. And it has been the absolute opposite. Our employees would, wear PPE all day long, 12-hour shifts. When we had an outbreak, we did have a few outbreaks. Those employees had to move into hotels to keep their own family safe while they continued to work at Chirstian Horizons to provide care for people. We had employees that moved from Hamilton to Whitby to be able to support teams that were in outbreaks, doing jobs they never knew that they had to do or never knew how to do. And they just were outstanding. So, the level of commitment that we had from people, and then families that had to sit back and say, you know what? I'm not going to be able to visit my loved one for 4 months. Imagine how hard that would be not to see your daughter for 4 months. And they absolutely worked with us. It was just, I get goosebumps thinking about the people that made this happen. It was absolutely phenomenal. And then, if you think about a group setting where there's 2, 3, 4 people who live together, who are used to going out to work and volunteer activities, into the gym, into the movies, into church, all of a sudden they're home 24/7. The creativity of things that they came up with. We had a backyard decorating contest. And so, the competitive spirit came out. We had campfires in living rooms where we simulated campfires, not real campfires, but, pretend ones, and roasted marshmallows and made s'mores. And a group of women down in Chatham, they spent their time making cards to send to the long-term care center down the street to encourage the residents there. So not only were the people supported being encouraged, they were encouraging others. Like just, amazing. It was an amazing experience. And while I wish it was over and never had ever happened, the stuff that happened throughout it absolutely inspires me.
So one of the things that people may not realize is that while many of us have kind of gone back to a lot of our normal routines and going to restaurants, wearing masks, but still we can go to restaurants or get takeout or go to the park. What does life look like for the people that you support? Because they haven't had the same opportunity yet in this community of belonging.
Yeah, it's a great point. And it's something we really kind of struggle with, right? It's how do you keep people safe in spaces that include employment and as well as people who live there, and facilitate what we all believe in about equality and citizenship and contribution. And we have to follow government directives. Government have been very clear because, I mean, there's real risk for people that live in spaces, even if our spaces are pretty small. They're not like long-term care where there's, hundreds of people that live together. Typically it's 3 or 4, maybe 5 people that live together, but that might also include a 12 or 15 person staff team. And there's still a lot of people in that space. And so there's been intelligent, thoughtful decisions made by government to manage that space to keep people safe. And like I said, I think we have done remarkably well both in Chirstian Horizons and broadly across the developmental services sector. But we're in the process of helping people re-engage and reconnect with community, because just like all of us, the idea of going out for a meal or getting my hair cut, I still haven't done that. I really need to do that. All those things are as important to a person who uses our services as a person who doesn't, right? Like just, somebody that, doesn't have those restrictions. One of the things that we've done early on is we have a internal group called Our Voice Matters, and it's a group of people who use our services, and they have a formal membership and kind of a self-advocate group, so to speak, and that's right across the organization. And so we've been actually relying on their advice as well, and they've had some wonderful ideas about how we help people. For example, how do we help people learn to use a mask when they go out? How do we help people to physically distance? We struggle with the idea of social distance because we don't want to be socially distant, but we have to be physically distant. How do we help people who, have a faith community that they have relied on for 20 years watch on video? That, those are big things. And how do you be a part of a community through a video? I would say, depending on the person who uses our services, there's probably been differences, right? For some people, they've been able to actually re-engage quite similar to you and I, and other people who require heavier supports or maybe don't understand the need for physical distancing or aren't able to wear a mask. That's a bit tougher for sure. And so we look at each situation, we get advice from our Voice Matters group, and we work with the family to try to come up with the best solution for sure. It's tough. My heart breaks, absolutely breaks for families who are desperate to meet. And, I had one person that uses our services say to me, my job at a grocery store is essential, yet I live in a group home for supports. How do we manage those two things? And it's a really good point.
Janet, your job as a leader has been stretched and challenged and all those things this year. So is there anything you've started doing that you want to keep doing post-COVID, or anything that you've stopped doing that you're like, yeah, I'm glad I stopped doing that. We're not going to do that anymore post-COVID?
Yeah, it's interesting, right? I think one of the things that we've done at Chirstian Horizons is really tried to have a posture of listening to the people who use our services. We were already on a journey to move from what we call person-centered support, which is a person at the center of their supports, and the idea that things are built around them based on that person, which is very good. But we've been on a journey to move to person-directed support. And that is basically that a person is really in the driver's seat, a person with a disability, and that they are going to determine their path. And so, once we got our legs underneath us in COVID, we thought, well, what a great time to actually let's go back and check in with each person and see how they're doing. What have they learned about themselves in COVID? What are the services that they say, you know what, I love that. I don't want to go back to that one. Some of our congregate day supports, maybe we don't reopen those. Maybe we've individualized those and broken them down, and maybe it's a matter of helping more people get jobs out in the community, or whatever. So I think, some of those things, there'll be blessings in this, that we learn how to support people differently and give people more prominence and power in the way that they direct those decisions about their lives. As an organization, though, I got to be honest, a lot of organizations are talking about technology, and technology has been terrific. Don't get me wrong. Us being able to connect like this by technology is fantastic. We've been able to check in with people through, different forums and web-based platforms so quickly and efficiently and inexpensively, right? Like, we're not having to travel and pull people together. But I could never, ever say that technology will replace people. The reason that we got through this, when I go back to, those three leadership, partnership, people, is how we got through COVID-19. And, the supports that we offer people, they may include technology, in the years to come to enhance their independence and their ability to manage their own lives and direct their own lives. But people are Chirstian Horizons' strength. And, I actually can't wait to get back to be with people. Yeah.
Oh, it's so good. Now, Janet, where can our listeners go to get more information or be involved? Or if there's a leader who's like, how do I integrate all people in my organization? How do they find that information out?
We would love to talk to them. Certainly Chirstian Horizons website, so chirstianhorizons.org, is sort of the first portal into the information. We're actually in the process of redesigning our website, so there will be some new looks in the coming months. It's not quite ready yet, but there's lots of connections there. There's resources for families. There's resources for churches or other faith communities. There's certainly resources for people with disabilities and information about the work that we do. There's opportunity to participate in the work we do, whether that's as a volunteer, as an employee, or as a donor. We welcome people to join our journey. We would love to talk to you. But to certainly our website, we have supports and services, as I mentioned, across Ontario and in many places in Saskatchewan. So depending on where you live and what you want to do, we might have people that could even be available for a message at a church on a Sunday, or to share about Chirstian Horizons' work and the journey of people with disabilities, and what that could mean for their church. Maybe today to be by Zoom, but hopefully in the months and years ahead, it could be in person. So we'd be thrilled to do that. There's a video on that website about the family camp. And this is one of our projects that I am actually most excited about in these days. Even this year, we were able to host family camps virtually. But usually, in non-COVID pandemics, we host this camp both in the summertime and in the wintertime, where we bring families together, families that include a person with a developmental disability, child or adult, and we bring them together for a week. It's entirely funded through our donors and through our relationship with churches. But it is a week or a weekend, depending on which one you choose, that families tell us, give them the energy, the will, the ability to get through the rest of the year. There's a video on our camp that says, on our website, and it ends with a little girl saying, "You should be here." And for families or people with developmental disabilities, check that out as well, because getting involved in our family camp programs is just an incredible encouragement to anybody that I've, whether it's as a camper or a participant or as a volunteer, it is an incredible opportunity.
So good. So there is room for us to be involved, which is a really good thing. I like that. Janet, is there anything else that you would like your peers who are leaders across Canada to know as they look at this season and the choices that they're making?
Yeah, Ellen, thank you for asking that. I think I would be remiss if I didn't also comment, back to our global work. Here in Canada, this is intense for sure. And I believe that we're going to hit a second wave soon. And I believe our days, our difficult days are not over yet. And for sure that is we'll see, right, in the next month or two what happens with that. But when I think globally, particularly globally about people with disabilities, COVID-19 is, it compounds already incredibly difficult lives. I've heard that the United Nations will expect that, many, many more people will die of a lack of nutrition than they will of COVID. Not because of, what COVID does to them, but purely because they can't go out and get food. They can't go out and make money to be able to buy food because of COVID. And, those are on a global level, on a, human level, that is an impending reality that the world is going to struggle through. But when I think of a person with a disability, I was in this slum in Kampala, Uganda, a couple of years ago. And it was an awful place. It's an awful place. So many people live in deep, deep poverty and, cycles of poverty that they just can't seem to get out of. The smell is so intense and bad of open sewage pits. And, you see this sadness on people's face and the loss of hope. And I remember coming around a corner and I ran into this young woman who lived there. She had an obvious developmental disability. I think she was a woman with Down syndrome. And she was about 8 months pregnant. And the reason she was 8 months pregnant is because not only does she live in that slum, not only does she probably struggle on a day-to-day basis just to stay alive, but because she has a developmental disability, she's also assaulted regularly. And there's no one who steps in because she's not worthy. She's, a person with a disability is so often in those communities shunned even lower than the how hard it is already to live. And she was used and abused by many people. And I think of her in these days of COVID-19 and how hard her life must be. If she's even still alive, right? But there's countless others that are like this young woman. And, I'd be remiss if we didn't sort of stay for a moment. And if, whether it's church communities praying, whether it's development organizations, we have great organizations across Canada that are doing amazing work in international development. I implore them to include people with disabilities on their agenda. I implore them to consider the most marginalized. A woman with a developmental disability in those communities has the hardest life of anybody that I can imagine. And we can't forget about them. And then COVID-19 on top of that, it boggles my mind. So each of us, whether it's to contribute to the work Chirstian Horizons Global does or to another great international development organization, whether it's for prayer support or whether it's, doing what you can even in your local community, each of us has an opportunity to contribute here, even though we're still trying to figure out how we make it through ourselves.
Janet, it is genuinely my privilege to get to be both your friend and to work alongside you, because this is such important work. And I am so grateful that you and your team are so dedicated. Honestly, I think that everyone who listens in today will have learned immensely. Thank you for taking the time to teach us. And I know we'll keep talking.
Yeah, thanks so much, Ellen. It's an absolute privilege to be with you and to know you and to know the things that you're committed to. And by sharing this story, I hope that it does inspire people to action. I also hope it encourages families who maybe feel very alone in their journey with their loved one who experiences disabilities, and know that there's organizations like Chirstian Horizons and lots of other ones that are doing terrific work. And the leadership and the everybody that's a part of these organizations have, through COVID-19, but generally other days, they're so committed to changing the world in this regard. And I think together we're making progress, and I'm very optimistic and hopeful about the future. So thank you for this opportunity.
Excellent. Excellent. Again, thank you, Janet. And if you are interested, if you're listening and you're interested in finding out what you can do and how you can be involved, and just to even learn some more, visit ChristianHorizons.org. Thanks again, Janet.
Thanks so much. God bless.
Thank you for listening to this episode of the Changemakers podcast, brought to you by Graf-Martin Integrated Marketing Solutions for Good. Graf-Martin is Canada's leading integrated marketing and communications agency for nonprofit organizations seeking to do more good. If you need an agile, full-service marketing agency to move your organization forward, we get it. Visit grafmartin.com to learn more and schedule your free consultation so that you can do more good.